all of you. I would now request Dr. Asha Jain ma'am to talk on overcoming obstetric challenges of midlife. Ma'am is the director of, ma'am, your CV slide please ma'am. Ma'am is the director of SMSA Raipur. She is the medical director of CPRS Raipur, elected member of the CGMC 2020 to 2024, Secretary IMA Raipur from 2019 to 21, President of the Raipur Obstetric Society for 2 terms, that is 2018 to 2022. She is also the President of the Rotary Club Raipur North 2019 to 20. We have done a few programs together, and I wish ma'am all the best and for a talk today evening. Over to you, ma'am.
Dr. Asha ma'am, you're on mute, ma'am.
Madam, unmute kariye.
Okay. So thank you, Dr. Priyankur. And one small correction to anyone who's listening. I'm Dr. Asha Jain and not Asha Singh. So good to see you, Patel sir. Now you are visible. At that time, your voice was wavering. So my topic today is obstetric challenges in midlife. And you know, this is a topic that I'm going to relate to medico-legal at this point of time. We've all heard of placenta previa and abruptio and PIH. So that is not what I'm going to be talking about today. It is obstetric challenges in midlife, but let us see how it goes. The flow of the presentation would be, the topic is challenges of obstetric. So we would define challenge, we would define midlife, then we would go on to ethical issues, life expectancy issues, fertility issues and preconception management, coexisting medical issues, counseling with consent, unveiling of medical issues on late conception, pregnancy specific challenges. This is not contraception, this is conception. Pregnancy specific challenges, sleep disturbances, familial and financial issues. So what is a challenge? A challenge and a stressor are two different things. Challenges refer to experiences that require great physical or mental effort and determination that test one's strength, skill, or ability. It is something, the word challenge used in this study is a word embroidered with strength and courage, allowing for the possibility that all challenges may not be perceived as stressful or appraised as negative. Stressor is a stimulus or threat that places real or perceived demands on the body, emotions, mind, and spirit of an individual. But again, a stressor does not pull up your strength. It does not initiate strength and courage. But a challenge makes you exert yourself for more physical and mental effort. So, obstetric challenges of midlife. That is the topic for today. It is a challenge and it is not a stress. Definition of midlife. At present, in medical literature, the age of midlife is defined as 40 and 65. We all know that this is wrong. This is totally wrong because the life expectancy in India is only 70 years for women. So how can 65 years be midlife? So midlife is, this study shows that both upper and lower limits of age need to be defined if we consider midlife in relation to fertility or anything else. So it usually starts 30 years before and ends 10 years before. So that is what is midlife. What we are talking about is 30 to 55 or 35 to 59 years of age. This is considered midlife. When we are talking of midlife obstetrics, what are the obstetric challenges? The challenges start not after conception. The challenges start right before that. What is the definition of midlife in relation to fertility? Midlife starts at 30 years of age, when your AMH values start increasing, your ovarian reserve starts getting low. So 35 plus, which 20 years back we used to call elderly primary, is now the time when conceptions do occur, but the incidence is low, is less. Beyond 40, it is much less. And beyond 43, it is really difficult for a woman to conceive on her own. There is another trend now, that is there is an increasing age of pregnancy. Previously in the West, it used to be 20 years, now it's gone up to 26. And this is a global trend. It's happening in India as well, where there is more of late marriages because women are getting self-sufficient. And this has been found directly related to the school admissions. The more girls who are admitted in schools, the higher becomes the age of pregnancy. Then, because of this, when pregnancy is delayed indefinitely, then there is an increasing demand for fertility services. There is a generalized decline in fertility after the age of 35. And there is another thing that we have studied the Western norm, and that is 51 years is the norm for menopause. But a study done by the Indian Menopause Society has found that in India, this is 5 years earlier. So in India, you have menopause, the average age is 46. And therefore, proportionately, there will be less fertility before that. Therefore, Indian women will lose fertility early. And if we always consider the Western criteria, there is overestimation of the fertile lifespan. There is another thing that many people who are celebrities or working ladies, high profile women, they have an idea that this fertility can be extended indefinitely. ART gives them that idea. And so ovarian preservation, egg preservation, embryo preservation, that has also come into the vogue. But at a higher age, there is a higher failure rate for all kinds of treatments. Third party reproduction therefore comes, and then with that come maternal risk, impact on the health and longevity of a woman. There is increased perinatal morbidity and mortality. There is a question of welfare of the offspring. When the child is born to a woman who is 60, how long is she going to be able to look after that child? Or even if it is 50, a woman of 50 producing her first child with a lot of comorbidities, how is the health of the child affected? Use of experimental and costly treatments. Then there are issues in the aging male as well. And there is a need for a cutoff for fertility services. There should be an age that beyond this, you're not allowed to go for IVF or anything else. Like for adoption, a combined age cannot be more than 90 years to get a child for adoption. Then why it should be more than that in assisted reproduction is a very major question. Now we come to the ethical issues. There is a line from Hamlet written by Shakespeare: to be or not to be, that is the question. So the question is whether the child should be born or it should not be born. We are talking here of failed contraception. Now this lady who is 40 years old has an 18-year-old daughter or a son, and suddenly has missed a couple of periods or maybe one period, and she suddenly feels nauseous. She comes to you and she finds out that she's pregnant. Now there is that question, to have that child or not have that child. Most of the time they opt not to, and therefore 33% of the abortions are in the midlife. Now the other part of it is, there is another lady who is 35 plus, and now she thinks that now I should have a child. So to have a child or not have a child? She comes to a doctor with that question, which is another obstetric problem. When you are counseling such a patient for obstetrics, life expectancy issues also come to the fore. How long? If she's 35, fine. But if she is 45 and her husband is 55 years old, then there are obvious life expectancy issues that this woman will have a child, and then maybe because of the higher risk, 20% complications of birth occur in the women above 45. The mortality is higher, the complications are higher. So these issues do come up, that who's going to look after the child if something happens to the parents. Then there is a question of fertility issues and preconception management. Once a woman decides that, yes, now I want a child, and she's in her midlife, then she needs to consult a doctor, even if there is nothing wrong with her. She has never tried before. But if she wants to have a healthy conception, then the obstetric challenge starts with preconception management. She has to be tested thoroughly for any comorbidity. And along with that, her egg reserve, then folic acid has to be supplemented, and she is allowed to try for 3 months. No more than that, because if she doesn't conceive in 3 months, then we should be ready to help her to get pregnant. Because if we don't do that, then there is a rapid decline in ovulation, and she might end up not having a child of her own. Older women who want to have a child have more options today than ever before. If conceiving naturally isn't possible, women can pursue assisted reproductive technologies such as in vitro fertilization or IVF, and the use of donor eggs and donor sperm and donor embryos. Now, this is where all the ethical questions come in. So, when a woman comes to you in midlife, late in midlife, then you need to be counseling her about obstetric problems in conception, problems in carrying the pregnancy, problems in the delivery, problems after delivery, problems in care of the child. All this has to be taken very good care of, and then with proper consent and counseling, you proceed forward for the treatment. Another thing that we have to understand is that many women who do not know that they have any disorder, and even in preconception testing, they are not found to have any disease. When they get pregnant, this pregnancy, the changes in the body, which are beneficial towards the woman's longevity, yes, but they also unveil a lot of medical issues in the woman in this period of time. So, medical issues like diabetes, hypertension, bony problems, they all appear when the conception is late. When this woman is coming to you for preconception counseling, then her breast examination, the pap smear, the HPV test, the vaccination status, all this also has to be taken into account. Now we come to the pregnancy specific challenges, and I know this is what you were all expecting me to talk about. But my friends, these are things that we all know, and we are dealing with them day in and day out. Pregnancy specific challenges: either the woman already has hypertension, or she might get PIH in her pregnancy. Then she already has diabetes, or she gets gestational diabetes mellitus. Psychiatric issues may be unveiled in this period, like schizophrenia, bipolar disorder, autoimmune disorders may be unveiled, coagulation disorders may appear, preterm labor and abruptio placentae are directly related to obesity and age. So these are all the challenges that we have. And if we have counseled about them very well, then we can really relax and manage them like any other pregnancy with full alertness. Yes, we should not always be saying that, this is okay, this is just because of age. We need to diagnose everything correctly and treat it correctly. There is another question, midlife crisis. Now, this woman is in her midlife and she is pregnant. And then, is there a midlife crisis? Occurrence when she gets a psychiatric disorder or a physical complaint. The occurrence of the midlife crisis has turned out to be a myth. Research shows 10 to 20% of people actually experience it. And although some consider it humorous and the focus of jokes, movies, and TV shows, what are the negative repercussions on us that when we promote the crisis as normal, we include ignoring mental or physical health problems, attributing it to midlife crisis, and thus we do a great disservice to our women. So we have to understand, we have to really rule out that there's nothing wrong. So after managing all these problems, then will the birth be vaginal or abdominal? Unless she has had a previous normal birth, a woman conceived after ART who's 40, 45, 50 would most probably have an abdominal cesarean section delivery, and that needs to be explained. Another thing, during the intrapartum period or immediate postpartum, this elderly woman has more chances of PIH, eclamptic seizures, diabetes mellitus, cardiac events, psychiatric events, and convulsions have to be ruled out from other causes, not just eclampsia, but it could be anything else in the brain as well that is unveiled in this whole process. So these problems are there and we need to be alert about it. And then obstetrics does not stop with the delivery. The practical postnatal problems of care of the newborn, care of the infant child, adolescent, adult, and the elderly already residing in the house. These all have to be thought of whether the woman is capable of doing it when you are doing her preconception counseling. And even after delivery, if she is not able to manage all this, then how she gets help for it so that her family life goes on comfortably has to be seen too. One reality is the sleep disturbance. This is a small child and it has its own calendar. It has its own clock, wants to get up in the night, sleep in the day, and the mother can't sleep in the day. She cannot stay up at night. And what is the end result? Sleep disturbance, when carried on for a long time, they cause a rift in her relationship. They cause unveiling of psychiatric problems, depression, anxiety, bipolar disorders, sometimes even frank psychosis. So sleep disturbances have to be planned for and taken care of before this woman goes home. The last but not least is the financial issues and the loss of income. A woman who has been working, maybe she has a big nest egg, but now once she has delivered, she has a small child to look after. She wants to look after the child at her own terms. So there is, because she's not working, there may be financial issues because of loss of income of one partner. In midlife, usually people are at the acme, they are in powerful positions, and suddenly when she's not able to work, it has financial issues have an effect on the mind as well. She's not working outside, the positive reflex reaction you get from people when you're working with people, when you're doing something productive out in the world, is missed. And this may again lead to depression. This has to be taken care of because a lot of our life depends and we thrive upon the interaction with people. And a mother has a child, yes, but she may be missing her interaction with co-workers, and that has to be looked after. Then this is another thing, that is that, you know, it's an elderly pregnancy, they have known each other for a long time, and familial issues start. There is research that shows that 30% divorces occur in midlife. There is a loss of partner in midlife. Sometimes there is loss of an elderly parent, and all these issues also disrupt the woman's life and ability to take care of her child. So, what do we do? What is the conclusion? The conclusion is that most pregnancies in midlife have a happy ending. This is the first point to remember. Preconception management is a must. Failed contraception needs to be taken care of. Pregnancy is high risk and proper counseling and consultation is needed. Preconception genetic testing has a definite positive role in ART with single embryo transfer, because twins have a 20% complication rate when the mother is beyond 45. Pregnancy will require high alert from doctor and patient, and role of obstetrician does not end with discharge of the patient. So, in the end, a happy practice, a happy midlife, and happy motherhood and fatherhood to all us doctors and patients. I thank you. See, this is a happy family. Aishwarya Rai had her child when she was 39 years old. So it's a midlife pregnancy, and living with elders, having them ill in the house, and still having a happy family, a balanced life. Thank you for a very patient listening. I offer these flowers to all who have listened to me. Thank you.
Thank you so much, ma'am, for extensively and beautifully covering about the midlife and a happy family life. I'm very sorry. Initially, it was, of course, everyone knows you, and of course, you are Dr. Asha Jain, ma'am. And the way and the knowledge that you have, I'm very sure that Foxy will definitely, and the Foxians who are present here will definitely benefit from your knowledge in the next 3 years. If, of course, once you get elected as the chairperson of the midlife committee. Thank you so much, ma'am. Now
Thank
the
you,
next talk is
Priyanka.
from
Thank you.